According to the article, there have been previous studies that have shown that exercise training improves body composition and cardiovascular disease risk factors. The target of this study was to investigate the effect of 12 weeks of performing aerobic, strength, and combined training on body composition and cardiovascular disease risk factor markers such as ICAM1, VCAM1, and CRP in sedentary middle-aged men. For the methods of this study, 47 males between the ages of 40 to 60 years old voluntarily participated and were divided into 4 groups: aerobic, strength, combined, and controlled. They were selected based on a certain subject criteria, such as their age, physical health, not attending an exercise training for 6 months prior to the study, lack of a specific diet, medications taken, and whether or not they smoke.
For aerobic training, the participants performed the training session using a treadmill 3 times a week on non-consecutive days and 20-minute pre-session at 60% of maximum heart rate to 60 minutes at 75% of maximum heart rate. Their heart rate was estimated by Karenan's formula. For the strength training portion, participants were taught the correct techniques before starting the training. The training program began 2 days a week in the first month and continued 3 non-consecutive days a week. The training intensity was 60% 1 rep max during the first 2 weeks of training and increased to 75 to 80% 1 repetition maximum. Number of sets was 1 to 2 sets during the first month. The program included 10 strength movements for the lower and upper body muscle groups. Participants performed 3 sets of 8 to 10 repetitions. Special strength exercises include bench press, seated row, shoulder press, chest press, lateral pull down, ab crunches, leg press, leg extension, tricep push down, and seated bicep curl. Lastly, for the combined training, the participants performed aerobic training along with strength training 3 days a week. They used treadmill 20 to 30 minutes in training session and then performed 2 sets of 8 strength movements with 8 to 10 repetitions.
According to the study's findings, body weight in aerobic and combined training decreased, BMI values in aerobic and combined training were lower, levels of fat percentage were reduced in all 3 groups, and the amount of fat-free mass in strength training and combined training improved. In regards to CVD risk factors, ICAM1 levels were only lower in combined training, VCAM1 levels were different in strength and combined training, and CRP levels was different in only aerobic training. The results indicated the 12-week workout with 20 to 60-minute sessions, 3 days a week of moderate intensity exercise improved body composition, ICAM1, VCAM1, and CRP compared to those who did not participate in any training. However, all 3 types of exercises had small benefits on body composition, ICAM1, VCAM1, and CRP in sedentary middle-aged men. According to the results of this study, combined moderate intensity exercise is recommended to prevent CVD and improve general health in sedentary middle-aged people.